this picture is of our neuromedicine hospital, but for those of you who actually come to our clinic, this is actually our real clinic. And I want to introduce Dr. Addie Patterson, who's also part of our team here at the University of Florida.
Hey everyone. Welcome to our symposium. It's nice to see everybody joining. It looks like we may still have people kind of trickling in and logging on, but welcome everyone.
Great. All right. Well, I'm Dr. McFarland. For those who don't know me, I'm the director of the Huntington, basically our HDSA center here at the University of Florida. This is our new clinic site. For those of you who have not been there, we opened up in 2018, and we expanded by greater than 50%. So I just thought I would show a couple slides for those who may be new to our center. You guys can actually drive up and park right in front of the center, so that's really new. The university is a very big place here, and parking has always been an issue, but really no longer at our center, so that's a real key feature. We spent a lot of time designing the center for patients and to be patient-centric. So it's really all about you to provide a comprehensive, clinical and sort of research experience here at our center. So this is the design that we put. We're right up a bit, sort of this foresty area. It's really a bright center, very open. That back deck is just for patients and families to be on. We are kind of right next to a little swamp. It is Florida. No gators seen so far yet. There may be some snakes and other wildlife. You are welcome to walk the back path behind the clinic when you're here at any point in time, those of you can. I will show you that we also have a really great rehab center. So you're going to hear from one of our rehab specialists. And maybe Addie, you can talk a little bit about what our rehab folks do.
Sure. So in addition to, our beautiful facility, I think one of the best parts is that in addition to being able to see your physicians when you're here for your visit for Huntington's, we have the ability to really provide multidisciplinary care. And so in our clinic space, kind of on one half, we have the physician and research teams. And then on the other half of the clinic, we have our rehabilitative services. And so that includes physical therapy. And you'll hear from Allie, one of our physical therapists today. We also have occupational therapy, speech and swallow therapy. And, it's really provided in this wonderful environment, which is meant to allow you to kind of interact with a more home-like environment. So outside they have, some different terrains like grass, it's Florida again, so some sand, rock-like terrains, and really put your balance to the challenge in a real-life environment so they can make the best rehab plan for you after you leave the center. So we're really proud of that. And then off to the right on this slide, you can see someone walking on a mat, and that mat is actually analyzing the person's gait. And so we use that as a research, but also as a clinical tool so that we can better understand how your walking is affected by your Huntington's at that point in time, and we can provide better care based on that data. So those are some of the aspects of our rehab care. And then we also, of course, as part of our multidisciplinary team, have our social worker, who you'll also hear from later. We have a genetics counselor, and we have the ability to interface with psychiatry and psychology. So welcome, and we're happy to have everyone here. And Dr. McFarland, I'll hand it back to you.
Yeah, great. Thank you, Dr. Patterson. So yeah, that is a little golfing putting area. So if you'd like to help us out, we can build the rest of this mini course in the back of our center. But yeah, we did put that in for golfers. So if you noticed that. What we don't really have a picture of is our research area. So the other half of our center is actually for our research coordinators. And all total, the neurology department has over 20, but we have several that are dedicated just to movement disorders and for Huntington disease as well. And last year, or a couple years ago, we added a couple of registered dietitians too. So please talk to us about dietary needs, nutrition, and let us know.